Walked into her room and found her jabbing around her vagina with a sharp object to make herself bleed. Doctors of Reddit, what's the biggest case of faking it you've ever seen? I was a nurse at the time. Guy came to ER for stomach ache. When asking him about history, he randomly mentions a fight with his girlfriend where she left in a tizzy and he fell asleep on the couch. 20 minutes later, when we see the CT, he has a satellite cable remote wrapped in a condom lodged in his rectum. I suppose he intended to frame her. Didn't get to hear the conversation he had with the doctor. I was curious how he was going to explain why she was nice enough to wrap it in the condom. Nurse for an ophthalmologist here. Had a 21-year-old new patient claiming to be completely blind from a sudden and severe glaucoma diagnosis from a previous unknown doctor. He would feel around while walking, tried to keep eyes rolled back into his head. The whole 9 yards. He said he is a famous YouTube rapper that is now unable to make videos or earn a living. I exclaimed to have heard of him before and very excitedly asked him to search and show me his YouTube channel on my phone so that I could subscribe. He took my phone out of my hand and effortlessly found the YouTube app and typed away in the search bar. Oh, and of course his eyes were back to normal and focused. Sorta along with the same idea. Working at a pharmacy, we saw a guy come in to try and get a refill on some pain meds that had no refill. After pleading that his ear really hurt, we told him again we couldn't refill it. One of the other employees saw his step into a side hallway and take a pencil and jam it forcefully into his ear repeatedly, drawing blood. He calmly left and went to the ER. He came back a few hours later with a prescription for pain meds. Physical therapist here. Working mom comes into the clinic with her infant in a stroller. She's limping like she's got a nail in her foot. Wincing in pain and tears in her eyes. She's crying during her visit with the PT. None of us think she's faking it. She limped out of the clinic. I glanced out of the window and saw this woman bounding down the sidewalk. Hips swaying, full stride, going places. We were all fools. I am a nurse but not a doctor. I had a patient who worked in a hospital, janitor, so he knew enough to fake a bit. He was seeking pain meds, complaining of chest pain, wanting morphine. He was worked up for everything cardiac and was fine. Then he tried to claim GI discomfort when he was being discharged. Cleared again for everything. Faked chest pain again. Cleared again. Now he's my patient. I'm a new face. He's telling me he's having abdominal pain. I call the doctor, knowing this guy's history. He says he'll be up to see him soon. This patient wants a ginger ale, some stomach ache. I decide to go to lunch. My coworker comes into the lunchroom, disgusted. This guy had taken a dump in a basin and then dumped the ginger ale over it and tried to tell her he did fecal vomiting. He obviously needed Dilaudid right now for the pain. I walked into his room and sure enough, a pile of shit and a puddle of ginger ale. I told him I'd have to take away his food and drinks and we'd have to put an NG down. Suddenly he changed his tune. He admitted to faking it. I'm a resident, not a psych resident, but this happened in my psychiatry rotation in medical school when I was in medical school. There was a patient at an inpatient psychiatric facility for suicidal ideation. She constantly insisted that she had a mass on her breasts and demanded to be physically examined only by male doctors. When the psychiatrist I was rotating under declined to perform a physical exam, she asked me to do it during my daily patient interview. I also declined the physical exam but had a bit of a hunch to check her medical records. It turned out she had an ultrasound done a week before that found only normal breast tissue without masses. However, apparently, this lady had frequented many doctors' offices with various complaints of an unspecific nature and would usually focus on breasts or vaginal complaints when she visited male physicians' offices. We diagnosed her with the factitious disorder, formerly known as Munchausen syndrome, and histrionic personality disorder. It seems her goal was mostly attention from medical professionals. She had lots of issues, but we also had to be careful to make sure she wasn't fishing for a lawsuit. Patients like her are why doctors document everything meticulously. So the patient wouldn't admit to making things up all the time. According to the psychiatrist I was working with, she didn't actually believe any of her health problems exist and her primary goal was the attention of medical professionals. If she actually believed she was sick, we would have diagnosed her with illness anxiety disorder, commonly known as hypochondria. My brother was an EMT for 2 years and he told me this. People will try to use the ambulance as a means for transportation from Fulton to Oswego, because the hospital is in Oswego, by faking seizures. Sometimes when the head EMT guy was feeling fun and knew that the person was faking, he'd say something like, "Man, it's weird that he's having seizures but not peeing himself." Apparently, the person would kind of snap out of it for a second, weigh up the repercussions, then either pee themselves or stop faking. I thought that was hilarious. ER nurse. Bringing a patient back to a room who said he had kidney stones. I had him stop at the bathroom and get a urine sample. Dude comes out with the specimen cup that literally has a piece of concrete in it. Looked him in the eye expecting some sort of joke. He was serious. I threw it away and walked his dumbass back to the waiting room to contemplate his stupidity. Had a patient who had been in and out of hospital throughout her pregnancy with episodes of heavy bleeding. This was her 6th baby, so she was a fairly well-known patient in our unit. The issue was no one had ever seen her actively bleeding. She'd call saying that she had bled down the toilet but flushed it, and all the examinations we did come back completely normal with mostly no evidence of any bleed whatsoever. On occasions during speculum examinations we'd see the smallest amount of blood. I was caring for her during a shift where she yet again called to say she was bleeding, walked into her room and found her jabbing around her vagina with a sharp object to make herself bleed. She had been doing it the entire pregnancy. The reason she gave, because she had 5 noisy children at home, needed some rest and knew we wouldn't admit her to the hospital if it wasn't for a good reason. She would do it any time her being discharged home was mentioned. We ended up having to complete a perinatal mental health referral and consult with the safeguarding midwives as she was putting herself and baby at risk of serious harm. This patient comes in for back pain with the weakness of the legs. Gets a full workup with MRI, standard blood work, and then some immunological things to look for stuff like myasthenia gravis. No neurological or immunological explanation for the weakness. The patient is seen by physical therapy and they are of the opinion that the patient is holding back intentionally. Go to see the patient at the end of the day and prep them for discharge. The patient is infuriated that they're being discharged. Yelling and screaming about how they aren't better, how they're disappointed in the institution, blah blah blah. They said one particular thing that still clearly stands out 3 to 4 years later. "I can't believe you're sending me home already. I haven't even told my family I'm here, and now you're going to send me home before they even have the chance to see me?" My attending and I leave the room to arrange things with the nurses. We go back in and the patient is out of bed and standing up in the middle of the room. Miraculously the patient is able to walk with zero assistance when they had so much difficulty with any assistance over the previous 2 days. At that point, they were enraged. We went into the room without knocking. They were discharged home after a conversation regarding the abuse of medical services. Young, 18 to 20, woman went running into small rural hospital ER pretending to have abdominal pain. A police officer had tagged her going 40+ km over the limit, which was stunt driving as per the new law in Ontario, impound and license suspension automatic. The cop followed her into ER and apparently said he'd be waiting for her when she left. Locum staff such as myself were housed at a small B&B about 15 minutes away, and the ER had pre-printed order sets to be done before we arrived. When I arrived she flat out admitted that she just came in because she freaked out and didn't stop. I told her we'd give her 45 minutes to call her parents/family before I booted her. Except, BHCG came back positive, and subsequent ultrasound came back showing extremely early ectopic. Officer figures out something is up when he hears air ambulance calls come in over the radio. She was completely asymptomatic and just worked out that she dodged both charges and a life-threatening issue by accident. It was definitely a WTF moment. Obligatory, not a doctor, I'm a nurse. We had a guy who had to come in every 3 months to get a medical certificate to say he couldn't work at his retail job due to severe disabling back pain. He was receiving large amounts of insurance money for this condition. After the doctor had done his usual examination and questions and signed it off, the guy asks the doctor to check his shoulder, which doc does, and asks how he injured it. Guy says playing rugby for a competitive team. Really, says doc? How long have you been playing for them? Guy has been playing and training the whole time. Doc puts this info on the insurance form. Doc loses his shit in the staff room laughing. Next week the patient loses his shit in reception because his insurance has been cancelled. Years ago I had a patient who had been rear-ended in an auto accident a few weeks before I saw her. She had a history of lupus. She was decked out in the usual I've crippled paraphernalia, crutches, neck brace, elbow braces, wrist braces, knee braces, and could barely walk. I saw her a couple of times and she showed no improvement. One Saturday I was on call but had to take a back streets route to the hospital because of an event taking place on the main thoroughfare. I apparently drove through her neighborhood, because, wonders behold, there she was wearing old lady spandex power walking down the sidewalk, holding weights in both hands. I did not call out to her. Next week, she was back in the clinic, with her I've crippled getup on again. A few weeks later I got the subpoena for the deposition, and it all became clear. My cousin got glasses. Her 7-year-old little sister also wanted glasses because she thought it was so cool to wear them. So she started telling her teachers she couldn't read what was on the chalkboard. And she'd squint at home, and go incredibly close to the TV to watch things because she said she couldn't see things clearly. Her parents got worried and took her to the doctor. She read everything wrong on the vision test. Everyone seemed convinced that she needed glasses. But the doctor was a little concerned because the tests indicated she needed really thick glasses, and usually that wasn't the case unless there was a family history of vision issues. Her parents both had 20/20 vision and her sister only had astigmatism. They all realized she was faking it. So the doctor told her parents in front of her that she'd need some pretty intense eye surgery so she'd be able to see without glasses. They even wheeled in a machine to make it convincing to say they could do the surgery right then and there. She freaked out, confessed to faking it all and started to cry. She got grounded for a while. 30 years/old woman came to the ED with such excruciating belly pain, paralyzed, oh god it hurts when you press there, must have oxycodone now. ED doc said if she can get out of the ED bed and do 20 jumping jacks, we can give her the oxy. She did 20 jumping jacks, then got kicked out of the ED. Not a doctor but I was in the ER one night and there was a seeking drug addict who literally only acted in pain when there was staff around. You ever see those videos where the little kid is fine and then they spot a parent and then bawl then immediately stop and be fine when the parent is out of view? Exactly like that. Sat fine, no movements or wincing or noises then wailing when a nurse was in the same vicinity, then back to fine when they left. 4th year medical student. On my ER rotation, a trauma came in from a woman that had been arrested. During the drive, the patient banged her head 4 times against the window of the police car and then went unresponsive. She came to us with a bruise over her forehead and unresponsive. We all smelled BS but the patient was a great actor, didn't even flinch during the digital rectal exam, which is standard for all patients that come in through the trauma bay. Though some of the nurses said that they caught her peeking at us when they would leave the room. We ended up getting a CT scan, which was normal, and was even considering intubating her to secure her airway when our attending finally walked over to her, opened her eyelids and held them open while telling her to wake up. Finally, she started fighting to close her eyes and the jig was up. The doctor called her out and she proceeded to start screaming at us. She was much more pleasant when she was pretending to have a brain injury. I'm an ICU and ER nurse. We get a lot of malingering in the ER. One day, one of our frequent flyers came in and started faking a seizure in triage. Now obviously I know this lady and she's fake seized a million times before. But this time it's in the lobby in front of about 30 people, who have no way of knowing that it's fake. She's lolling around on the floor making a damn fool of herself and folks look horrified. I walked up to her and said calmly, "Karen, what are you doing?" To which this genius responds, "I'm seizing." I told her to stop seizing. So she did. A patient claimed to have all kinds of illnesses and would cough every minute or so. Have you tried coughing when you don't need to? It's like a normal cough but you take the subwoofer away. Now imagine that, but 10 times faker. Prisoner came in with signs and symptoms of a big stroke. At that time the protocol was to get a non-contrast head CT to rule out a bleed and then give PA, a powerful clot-busting drug that's only worth the risk if the benefit is to mitigate a major stroke. So that's what happened. Later in the course, he got a little carried away and started embellishing his story with symptoms that didn't make sense with his stroke diagnosis, and that's how we figured out he was faking it just to get some time away from jail. No doctor but a funny story from work a couple of years ago. Guy calls in sick for around 8 days, says on the phone he is really sick. Comes back to work the next week, tanned as FCK. This dude hands a medical slip to the manager written in Spanish. On the slip, there is an official seal from some random Cuban clinic. The guy walks over to me with a grin on his face saying, "Yeah, I'm probably fired." He was fired. Not a doctor but a nurse. I once read a specialist consultation report, and at the end of the report the actual diagnosis given was fictitious ailment. My mom was an emergency room nurse. Years ago they brought a prisoner from the local pen who seemed to be unconscious. The guards were suspicious that he was faking it. They checked his vitals and everything seemed to be okay. The attending doctor tried poking him in the foot with something pointy, nothing. Then he got an idea. They took a rubber hose and inserted it in the back of his throat as if they were intubating him. That did the trick. He sat up very quickly, coughing and gagging. Thank you for watching Reddit Space. Please subscribe if you love these Reddit stories.